If you're turning 65 or already on Medicare, you could be making one of these 7 common and expensive mistakes. I'm Bill Green. I've been helping folks navigate their Medicare for over a decade now. Let's make sure you avoid the stress and get the peace of mind you deserve. So I've been at this since 2014. I used to work for a bigger company where we had a select number of products to pick from, but really couldn't help everyone. So what I want to do is I want to be able to make sure that whenever I met with somebody, as long as they liked me and I liked them, we could help them out. So what really brought me into wanting to do this initially was my mom. She went Medicare about almost 12 years ago now, and she sat down with someone who sort of explained Medicare, gave her a few options, but didn't give her all of her options. They worked for a company like I did. Nothing wrong with it, but just didn't give her everything. She was very worried about breast cancer. She had some older family members who had in the past, but this person didn't offer her plans to cover either all of her costs or just get a simple, inexpensive cancer plan to go with it. So about a year to Medicare, right when I started the business, she was diagnosed with breast cancer. She got it really early on, so she's fine, but she still had big out-of-pocket costs because she wasn't offered all of or multiple options. So we just want to make sure everyone we work with knows everything's available and all of their options. So we've worked with thousands of people on their Medicare, helping them decide whether or not it's right to go on Medicare, when to go on, what plan to pick. In doing that, we've seen a lot of mistakes. So the very first, most common mistake we see, and a lot of folks frankly ask about, which is a really good thing, is missing their initial enrollment window. So that comes down to is if someone actually even has to go on Medicare, and then what that looks like. So missing your enrollment window can end up with very expensive penalties that are lifetime penalties. So your window to enroll in Medicare into original Medicare by itself, if you're not already in Social Security, is 3 months before up to 3 months after. Your Medicare Advantage plan or Part D plan is that same window. What happens though if you don't enroll in that time period, you don't have some or other form of credible coverage, when it comes to the actual penalties, the penalties that happen are Medicare Part B. If you don't have other credible coverage that's credible to Part B, that penalty is a 10% per year penalty. Each year you go without coverage, it's 10% added on. That's a lifetime penalty. That penalty will never ever go away. Part D is a little bit different. Part D is your drugs. For that, there are some plans that will use Medicare, specifically the VA, that don't incur that penalty. But if you don't have other credible coverage, Part D is 1% per month of the average drug plan cost. So about 12% per year added onto your Part D drug plan as well. So real life example of this, I have a couple family members who both only used the VA for years and were just unhappy with their care. They wanted to get some other options. So they were both actually 75 when they came to me. We had to wait until the end of that year. They both turned 76. They both have a 110% Part B penalty because they didn't enroll in Medicare for the very first time. Frankly, the VA kind of messed that up a little bit. Back then they were telling people they didn't have to enroll in Medicare. Now the VA is telling people you really need to enroll in Medicare just to have other options. So the second most common mistake we hear a lot is Medicare covers everything. I paid into my whole life. Why do I have to pay for it? And shouldn't I just have everything covered? Unfortunately, that's just not the case. So number 2 is that Medicare covers everything. And that's just simply not true. When it comes to Medicare and covering everything, number 1, you have to pay for Part B. For most folks in 2025, that's $185 a month. It'll come right out of your Social Security check. If you're drawing Social Security, if not, you have to pay for it. So Medicare Part A has kind of fixed costs for your hospital stays. Part B though has a small deductible. This year it's only $257. After that though, it's an unlimited 20%. So without some sort of secondary coverage in place, you're responsible for 20% of everything. Also, Medicare does not care about your eyes, your ears, or your teeth, unless it's medical. So eyes, if you have cataracts or glaucoma, they'll cover it, but no glasses or contacts. Ears, if you have an imbalance and you're falling, that's medical, they'll cover that, but no hearing aids. And then teeth, if you have a infection in your mouth or a major accident that rebuild your jaw and your face, they'll cover that, but they're not gonna do fillings, cleanings, crowns, or dentures. So the third most common mistake we run into and hear just a lot is I'm gonna pick my plan based off what my spouse, friend, or family member has. So while it's a great idea to talk to those people, you don't necessarily wanna do that. So the issue you run into when you talk to a friend or family member and pick the exact same thing you have is if they're not in exactly the same health, take the same meds, the same dosages, see the same doctors, it just doesn't work. So what if you talk to a friend who is super healthy, they're a marathon runner, and they don't care about what their medical costs, they just want some extra benefits. Their plan is extra benefits, bunch of dental, vision, hearing, all sorts of extra stuff money spent in the pharmacy, but you're not so healthy. You go to the doctor a lot, you take a lot of medicines, it's very likely you'll end up in the hospital. Those plans that have a lot of extras tend to have a lot of high out-of-pocket costs. The problem is if you're using the doctor a lot, go to the hospital, you might want those extras, but it's going to cost you a lot more financially. So what's super important is to talk with us, a local insurance agent. What we're going to do is we're going to sit down and go over your doctors, your medicines, your healthcare needs to help you find the right plan for you based on your health. So the fourth most common mistake we see a lot of people run into is not checking their doctors. They'll pick a plan, again, based on the super low out-of-pocket costs or maybe all these extra things. But it's important if you see doctors to make sure that they're actually in network. So there are two versions of Medicare. There's original Medicare, which you can see any doctor anywhere, anytime. You can't see a pediatrician anymore, but that's not an issue. The other version is Medicare Advantage plans. Those have network of doctors. Some have very small networks with a lot of times robust extra benefits, and some plans have far greater networks where you can pick from almost any doctor. What's important there is you're actually seeing a doctor that you like and you want to maintain that relationship with. If you're picking your plan based on benefits, not doctors, you might lose access to that really important doctor who's taking care of your health. So about a week ago, somebody called in based on a referral and their family member had answered a phone call. Here's the thing, if someone's calling you about your Medicare, they're breaking the rules. We're not allowed to call people, unless you ask us to. So what this person did is they were cold called and this person said, oh, I have this great plan, it's gonna give you all this money back, give you all this extra stuff. And the person said, oh, great, because they weren't thinking about their doctors and their medicine. So they switched this plan, and then the procedure they were supposed to have this month, they were not able to get because the doctor that was going to do it is now out of network. So that really hurt their health situation. So again, when it comes to picking a plan, don't pick a plan based off all these extra benefits. Look first for a plan that's going to cover your doctors and your medicines, and then we look at the extra stuff. So the fifth most common mistake we see a lot is people who don't understand their drug plan costs, and that's changed a lot this year. So this year in 2025, for the very first time ever, we have a $2,000 max out of pocket on medications. So what that really comes down to is if you're on expensive medications, you'll almost certainly hit that. But when it comes to drug plans, there are two versions. There's the defined standard and then enhanced benefit. If you have an expensive medicine, you're on the defined standard plan, you're almost certainly going to hit that $2,000 max. You're going to spend $2,000 at the pharmacy to get those medicines. There's a program called M3P, not MP3 like music, but M3P that can help reduce those costs throughout the year if you happen to be on one of those plans. But the alternative, if you're able to do it, is go with an enhanced drug plan. The enhanced drug plans don't follow that defined standard. They may have a set copay for your expensive medication. But what's really cool is that the copay is what you pay at the pharmacy, but the overall cost based on the defined standard plan is what counts towards your $2,000 max out of pocket. So if you're on expensive medications, it's super important to shop your medicine plan to make sure that you're not going to overpay by hundreds or $1,000+ just for medicines you could get for way less. So number 6, this one we hear towards the end of the year, thinking Medicare is just one and done. So that's a sort of answers. If you have a Medicare supplement or a Medigap plan, that a lot of times we just don't really mess with unless it's had some major rate increases and you can still qualify with health to change plans. But even if you have a supplement or a gap plan, it's still important to shop your medicines, which if you're a client of ours, we send out a link every year. It's super easy to shop your own plan. Basically, you just put your meds in, it populates, these are the right plans for you, and you enroll in it. If you're on a Medicare Advantage plan, those are a little bit different. Those have your medicines, your doctors kind of built in, as well as your fixed costs. Those are super important every year to shop your plan to make sure you're in the right spot. If you're a client, again, we send that link out beginning of September to find out what's going on with your current plan. And if your plan's working well for you, if you're a client, we'll still look at it, see if things maybe are going to change. But if you're not a current client, you're not hearing from your agent beginning of September or all through open enrollment, you absolutely need to check your plan to make sure nothing significant is changing. So this isn't every year, but from 2024 to 2025, we actually had some Medicare Advantage plans locally that just went away. And the problem with that is if someone was on that plan and they did nothing, come January 1st, they had no coverage but Medicare A and B. They had no fixed copays and they actually had no medicine coverage either. So it's super important to pay attention to your, what we call annual notice of change that comes out in September to make sure that your plan just isn't changing a whole lot, but also just make sure it's going to exist. So number 7, a lot of people will think, oh, I can just do this on my own. I'm turned 65, I've been using a computer my whole life, I can figure this stuff out. So number 7 is doing it on your own. So while you can certainly do a ton of research on your own, the only website out there that has no bias at all is Medicare.gov. So if you're gonna shop, start shopping there. But the problem is if you are going there and you enroll direct to an insurance company, you then have to call that insurance company yourself. If you have a problem or question issue, you're calling an 800 number where you may or may not get someone who speaks English. Also, who knows how long you'll actually wait on hold. But that's for just a drug plan and a supplement plan. A Medicare Advantage plan, they'll put these little snippets of information up there that say this is your primary care, your specialist, maybe one other thing. It's nowhere near enough information to actually truly pick a plan because there's so many other internal costs and those added benefits we talk about. Each plan is significantly different. And also with that, depending on where you live, if you live in a zip code that has multiple counties in it, if you don't select the right county, you may try to pick a plan that isn't even available to you. So what's important is to work with a local insurance agent, or we also work about 20 states throughout the country. We get it, Medicare is personal. So when you're ready for help, that's what we're here for, to help you pick the right plan based for you and your healthcare needs. If you have any questions, comment down below what your questions are. But also, when you're ready, give us a call, 866-717-1176. You can also visit our website, greenins.com. Do me a favor, like this video, subscribe to our channel. That way you can stay up to date on our Medicare tips.